Hello po, good evening sa lahat. Welcome po ulit sa ating ngayong episode ng Halalan Health Talks. No? So welcome po sa mga bagong pumasok, sila Joanne Zurk Dela. Again, anong ginagawa natin ngayon dito sa ating Halalan Health Talks? Dito po kasi sa Kabayan Party List, naniniwala kami na kailangan ng bigyan ng pansin ang health, health issues ng bansa. No? Almost 2 years tayo, pandemic. Wala na tayong ibang narinig everyday kundi COVID, COVID. Parang nabibingi na po yung ating tenga, no? But in other words, it's really the issue. And of course, although yes, we need lawyers, we need law experts, but I really believe we need doctors. I really do believe kahit isa man lang o dalawa, no? Kaya dito sa Kabayan, nandito kami ni Doc John D. Flavier, nasa party list kami. Ngayon, meron po akong in-invite, no? And I'm very happy na she's a doctor. And kailangan makilala natin siya. Siyempre, doktora siya. So, ibig sabihin, she's focused in helping health issues. Hindi siya katulad yung parating nasa TV or politician. So, alam natin na kulang pa yung ating knowledge about her. But kailangan bigyan natin ng chance. Makinig din naman tayo sa other choices na possible maging senator po. And this one is a doctor po. So before I call her, gusto ko lang muna i-introduce sa inyo. Ang pangalan po niya ay si Doktora Maria Dominga Padilla, or she's called Minguita, no? She has been practicing medicine for more than 30 years. Isipin niyo, more than 30 years na po ang practice niya, but actually she looks very young. You will see that tonight. She has also been a health advocate and advisor to both DOH and congressmen and senators, no? Nasa background po siya as advisor ng mga senador, isipin niyo po 'yan. For 27 years, and among her most notable contributions to the field of medicine both here and abroad. And gusto ko na siyang magpakilala sa kanyang sarili, and i-interviewin po natin siya. So let us all welcome Doktora Minguita Padilla. Hello po, Doc.
Hello, Richard. Good evening sa iyo at sa mga viewers mo sa gabing ito. And thank you for having me.
Yeah, it's a pleasure, Doc, that you're here. Kasi siyempre itong aking page, health talaga kami dito. Ilang nagpa-follow dito, puro health. They love health discussions, and Doc Willie Ong was also a big part of this page. So ngayon, andito ka po, and we are very happy that you're here. We want to know you more, Doc. We are very excited because you're a doctor, and then you're running for Senate. So gusto ka naming makilala. Let's start, Doc. Childhood, no? Yun kasi ang inuuna kong tanong, Doc. Sino si Doktora? Saan po pinanganak? Ano yung childhood life mo and inspirations mo, and bakit kang nagdoktor, etc., etc. po? Yes, Doc.
Okay. Okay. I was born in Manila, no? Kaya lang ang father ko, ang family of my father is from Pangasinan, sa Lingayen. So, and my mother naman, Baguio. In fact, kinuwento ko, may video ngayon sa aking page tungkol sa roots ko sa Baguio. Ang aking great-grandmother, Igorota. Igorota talaga. Her native name was Katday. Okay? Then she was para daw siyang prinsesa doon na gusto siyang ipakasal sa lalaking hindi niya gusto. Kaya tumakas siya. And she met, no talaga, this is my mother's life, she met a Irish-American na engineer who isa sa mga gumawa ng Cannon Road ng Baguio,
Yes,
no?
yes, opo.
His name was Samuel Batty at kinasal sila. So, tatlong anak nila, tatlong babae, Lily Daisy Pansy, yung pinakabata, naging lola ko. But that youngest Pansy, namatay kasi yung father nila when she was a baby. Inadopt naman siya ng longest-serving chief of police ng Baguio, na American, na J.J. Keith. No? So, she grew up as the daughter of the chief of police. No? So, maganda yung storya ng lola ko. Tapos, that was my mother's side. And then she got married to an American-Spanish man, no, na gwapo, na, then my mother was born. No, that was my mother. My father naman, nakakatuwa, di ba? My father naman, yung ninuno namin sa father's side is from Lingayen, Datu Munamon. Yung Munamon, yung
Mm.
isda ng bagoong, yung maliit na isda
Ah,
na ginagawang bagoong, lalaki, Munamon. But he fell in love with Maria Padilla, isang prisoner, political prisoner from Spain,
wow.
na nilagay, she was brought to Lingayen kasi she was supposed to be exiled to a very far uninhabited hostile land kasi she was
Mhm.
a political prisoner who was making a lot of trouble for the Spanish royal family, I think. So she was brought to Lingayen and love at first sight yata si Munamon, pinakasalan si Maria Padilla, and he took her name. Otherwise, I would be
Wow.
Doctora, otherwise I'll be Doctora Munamon.
Oo
Kaya
nga,
naging,
okey,
oo,
opo.
Padilla kami, pero ang unang Padilla sa Pilipinas ay babae, Maria
Okey.
Padilla. So that's,
Ah,
and then of course, meron din akong roots sa Cavite. I have very
mhm.
historical roots eh. So,
Oo nga.
but as a child, I had a very happy childhood, normal, eldest ako, I'm the eldest child, and
Mhm.
I didn't want to be a doctor right away. Ang dami kong
Okey.
ibang gusto. I wanted to be a lawyer because my father, we come from a family also of lawyers. I wanted to be
Hmm,
an actress. I wanted to be a concert pianist, pero maliit
kaya
ang
nga
kamay
Dok,
ko.
eh. Puwede ka
Uh,
talagang mag-artista Dok sa itsura pa lang, eh,
nag-model na lang ako, commercial
Wow,
model for a while. Yeah, when I was in pre-med,
wow.
pang dagdag allowance, parang to add, gano'n. Tapos, in first
Oo.
year of medicine, pero hindi na kaya kasi mahirap na yung schedule, di ba? Pero I did
Mm.
some modeling and then, pero I also wanted to be so many things. But in high school, I decided sa retreat, sa fourth year high school, I said, I'll go on retreat with my high school classmates. And doon ko na-decide, I asked God, in what field can I make the most of all the talents you gave me? Kasi ang dami niyang binigay na biyaya sa akin. And
Mhm.
my father always told me, to whom much is given, much is expected. Di ba?
Yeah,
Kung
true.
maraming biyaya sa iyo ang Diyos, marami din siyang ine-expect na ibigay mo sa kapwa
Amen.
mo. Di
Mm.
ba? And
Yes
so,
po.
that is when I decided to become a doctor. But I
Wow.
didn't want to be an ophthalmologist right away. I wanted to be many other things again. So, but I became an ophthalmologist because my father had very weak eyes.
Mhm,
Napakahina ng mata ng father ko. Awang-awa ako sa kanya. Kasi
mhm.
naging Supreme Court Justice siya, di ba? Basa ka ng basa, basa ka ng basa.
Hmm,
But hirap na
hmm.
hirap siya. So I could see I wanted to help him. That's what, sort of egged me on to take ophthalmology. So that's where I
Mhm.
ended. Although ophthalmology was not my highest grade, ah. Hindi siya, hindi siya, hindi ako nag-shine sa ophthalmology. I like physiology, I like public
Opo.
health public health was my
Wow.
favorite. Yeah, pero
Mhm.
I ended up with ophthalmology. But I'm also in search of public health until now, di ba?
Yes, opo.
Advocate. So, andun pa
Mm.
rin yung love for public health, eh,
Yes po.
lumalabas pa rin. Eh. So
Opo.
yun, that's how I got here. But my childhood was really happy. Summers in Baguio, playing, patintero, basketball. I was an athlete. I was in the
Mhm.
swimming team of UP, medicine.
Wow, wow.
Marami, glee club. Parang I did everything practically, no? So happy growing up years. So
Sa
then I'm
yung
here.
schools mo Doc, alin po yung like high school mo and college
Okay.
and medicine?
Ako, tatlo ang school ko eh. Grade school, elementary was St. Scholastica's College.
Mhm.
Yung mga strict Belgian, German nuns yun, very strict, no? Then I went to Assumption. Iba-iba. I went to Assumption for high school. Yung mga
Mhm,
nuns naman doon, masyadong malambing, French. So,
mhm,
ibang-iba
mhm.
yung atmosphere from Saints ko to. Then, they wanted me to be a nun for a while. Gusto ko mag-madre din, no? Tapos, then I went to UP for pre-med,
Mhm,
zoology. And
mhm.
then UP Medicine also proper. And
Okey.
then I did 1 year of internship in Makati Med kasi
Mhm.
I decided na aalis muna ako ng UP kasi ginagawa yung UP noon, nag-rebuild sila.
Yeah, okey.
Tapos nabagsakan ako ng dingding habang
Wow,
natutulog ako. Naka-duty ako sa ENT tapos I was fourth year medicine. I was sleeping. Then biglang bumagsak
wow.
yung dingding katabi ko. Sabi
Ah,
ko baka I was lucky I didn't die, di ba? So
yes.
sabi ko sa sarili ko, siguro kailangan umalis muna ako kasi nag-duty kami, naka-hard hat, kasi nagbe-build ng central
Wow.
block. So
Oh,
I went to Makati Med for 1 year and I met a lot of people who also helped me later on in life. So there's a reason.
wow.
Then I went back to
Okey.
PGH. I went back to PGH for my specialization in ophthalmology. No? And
Okey.
then eye banking. I was the first one. I went to eye banking sa Baltimore at sa Prague.
Oh,
no?
wow.
To put up the iBank. So yun ang naging ano ko,
Okay,
journey
Doc.
towards now.
Ano muna, Doc? Kasi alam ko sikat kasi itsura mo pa lang, Doc. Alam kong sikat na sikat ka doon sa
Ginabahan.
ospital. Love life po, Doc. Paano kayo
Opo.
nag-meet ni Mister and ilan na po anak nyo?
No, actually, love life ko is a topic of movies. Actually, late na kami nag-asawa ng husband ko because we
Mm.
had other loves before. And
Mhm.
medyo chope siya, torpe siya. Hindi niya ako niligawan kaagad. Kasi ang feeling niya, ano to he felt na he wasn't worth it. So he came back from the States. Hindi siya mayaman. Ang parents niya are both government doctors. He went to
Mhm.
UST. So my husband's name is Lopez. So I'm
Mhm.
Padilla is my maiden name. So ginagamit ko yung professional name ko as maiden name. No? We agreed on that with my husband. He's Lopez. And then, pero hindi yung Lopez na ABS-CBN Lopez. Ito yung Lopez from
Mhm.
Nueva Ecija. No?
Okay.
And when he came back from training in the US, people were pairing us off together. Kaya lang sabi niya, I'm not, parang hindi ako worth, hindi pa siya, he cannot offer me anything. Parang ganon. So medyo na-chope siya. And we ended up with other people first before our paths crossed again. But we were
Wow.
already mature. We were already had
Wow.
our lives, no? So I have a stepson with him who's already
Mm.
married, no? Pero wala pa
Mhm.
kaming apo. And then,
Mhm.
but we're very happy and we are, ang dami kong pwedeng ikwento tungkol sa love life how mga lessons you learn,
Yeah.
but it might take a long time. But to make a long story short, we're both ophthalmologists, okay?
Okay.
Kaya lang, ang aking subspecialty ay cornea, transplants,
Mhm.
laser, etc. Gumagawa kami ng lahat, cataract,
Mhm.
refraction, gumagawa rin kami ng konting glaucoma. But if you want a subspecialist, ang sa kanya
Mhm.
naman, plastic surgery and reconstructive
Wow.
surgery. So, yan ang kanya. Ako
So
naman, transplants. Kasi sa
mhm.
iBank, transplants ng cornea, laser, etc., etc.
Mhm.
So we have different subspecialties. Ganun na grabe ka
Wow.
specialized in ophthalmology. But we do
Mhm.
general, no?
Opo, opo.
So medyo lonely siya ngayon kasi I had to take a leave in order to
Yes.
when I decided na tatakbo ako, medyo malungkot ako at medyo takot. Siyempre kasi we're not politicians, Richard. Di ba? Ibang-iba
Yes.
yung buhay ng politicians sa
I know.
doktor, no?
Opo,
So
iba
different. But
talaga.
iba talaga at nakakatakot yung decision ko na to. And there was sabi ko nga nung when I filed my candidacy, sabi ko ay may halong takot at lungkot, no, ang pag-file ko na to. Pero kailangan kong gawin kasi kasi dahil sa maraming dahilan that we can talk about later, no? And why
Yes.
lungkot? Kasi iiwanan mo yung mga pasyente mo. Imagine, more than 30 years you were a doctor.
Yes.
Some of
Yes.
those patients were my patients from the very start. So
Yes.
parang talagang may relationship ka na, no, with your patient. So
Yes
syempre,
po.
iyakan yan sa clinic, iyakan yan,
Mm.
no? Pero mga
Mm.
pasyente ko are also saying, never mind, doktora, we understand, no? And our
Mm.
loss hopefully will be the country's gain, sabi naman nila. So there's a lot of crying. And
Wow.
kasi you have to endorse your patients to
Yes
doctors, di ba?
po. Yes
It's,
po.
it's very, very
Mabigat
difficult. Tapos
'yun.
mabigat talaga yon. Alam mo yan, kasi doktor ka. Tapos hindi lang yon, yung pagturo ko sa PGH, I've been teaching
Yes.
since 2008. I had to resign. Okay?
Wow. Wow.
I had to really leave them all behind. I had to resign from the iBank kasi I had to turn it over na. I've
Mm.
shepherded
Mm.
yung iBank since it was founded.
Wow.
Okay? And for 27 years. And then, I also, batang-bata pa ako noon. and then and then I had to also resign my international positions because I have international positions. So
Wow.
I
Ang
said I'll
daming
resign
ano.
all of that, so I can concentrate on this
Oh,
ito
yes.
ngayon, no? This quest for a seat in the Senate. Kasi as you said, Richard, sa simula nito, kailangan natin ng doktor sa Senado. Talagang
Yes po.
kailangan. No? So
I
yun, that's
agree. Doc, another question. Is this the first time you went into politics or any like running on a position, not necessarily Senate, pero po ba before?
first time. First
So
time ako tatakbo. I was in government for a short while as in PhilHealth. I
yes,
was
yes.
appointed 2015, that's March 31, 2015 hanggang June 30, 2016. Very short. I said,
Yes.
like SOS lang sa akin, no? To help, no? And I helped.
Mhm.
But I never ran for any position
Okay.
before. Although our family is a family of politicians also, ang mga lolo ko. Si
Mhm.
Lolo Ambrosio Padilla, Senator Padilla, was
Mhm.
the brother of my direct grandfather, no? Then his brother Benedicto was a congressman of Lingayen, no? So, of Pangasinan. So,
Mhm.
nasa lahi naman, pero yung next generation walang nagpolitiko, no?
Okay.
Then
Okay.
I never thought I would enter politics or run. But
Mhm.
talagang sometimes God has His own plans for
Sige
you.
nga, Doc. Can you
Oo.
tell us that story na paano po nangyari ito? Paano naka-decide ka talaga? Paano nag-start? Like, can you describe that day or may
Okay.
nagkausap ba sa iyo? Like anybody,
It's
ganyan?
gradual. It's
Okay,
gradual.
gradual.
Gradual but building up talaga. Kasi, well, ever since, even in the 1990s, some people were already inviting me to run for the Senate. I kept
Mm.
saying no. Kasi sabi ko, I had just put up the iBank, and then this is mga late 1990s to the 2000s na, no? I just put up the iBank. I want to still prove myself. Sabi ko pa, anong nagawa ko na para may karapatan ako maging senador? Yun pang tanong ko sa mga tao noon na inviting me. These were politicians. Eh. Ang sagot mo naman sa akin, ikaw, unang-una, may pangalan ka, Padilla. Second, maganda ka, marunong kang sumayaw, marunong kang kumanta, okay na yun. Sabi sa akin, sabi ko, ganyan lang ba yan? Di ba? Kung minsan ganun ang isip nila. But I said, no, no, no. Private sector na lang ako, tutulong na lang ako. And I did a lot in the private sector, di ba?
Mhm.
I mean, aside from the iBank, which I think is one of my lasting legacies, no, to the country, I hope it's lasting. Yung advocacy, yung tumutulong sa DOH, mga senador, no? Tapos, madami naman akong nagawa. But, no? This pandemic talagang, yun ang talagang last push, no?
Yes.
Because I was involved sa pandemic response in the private sector, no? Remember in the beginning, talagang ang gulo-gulo, di ba?
Opo.
So, two major things. Sa PGH, kasi COVID Referral Center ang PGH, di ba? So,
Yes.
yung we really helped. I had an effort to really help the healthcare workers, no, sa mga PPEs, pati mga washing machine, electric fan, kasi
Mm. Mm.
nakatira sila sa ospital 2 weeks straight,
Yes.
di ba? We
Yes.
tried to make their life livable, no? Pati unan, pati kumot, lahat yon kasi natutulog sila sa auditorium. Ganun kagrabe ang gulo noon, no? So we donated, I got donations. We also, yung donations, hindi lang sa PGH, sa iba't ibang ospital yan, no? From National Mental Hospital, Lung Center, Manila Hospitals, lahat yan, we helped, no? Then I was also the medical lead of Project Art. Itong group of Joy Concepcion, yung Go Negosyo,
Yes.
MSMEs, no?
Yeah.
Micro, small, and medium scale. We help them open up again their economy, parang give them some hope kasi ang effect sa mga MSMEs. They're the worst hit. Many close,
Yes.
di
I
ba?
agree. I
So
agree.
so we doctors also help them open up, understand what are the tests, how can they use the tests available? Kasi noon wala pa namang masyadong PCR. How can they open up gradually? How can they use symptomatology? How can they combine PCRs with antibody testing? We tried to do what we could, no? And
Mhm.
guide
Mhm.
them. So yun ang isa sa ginawa ko rin. So
Mhm.
nakita ko rin, Richard, yung pagkukulang ng
Mhm.
response, no? I don't want
Yes.
to delve into the negative too much, but let's put it into summarize, no?
Yes.
Marami magagaling sa gobyerno, marami. Pero marami rin who took advantage and used
Yes.
the pandemic to make money. Yun
Mhm.
ang
Mhm.
garapalan talaga, which I saw. And I tried to do something, but kami pang napasama, no? So I really lived through this whole thing. Sorry.
Mhm.
I lived through this whole thing. And a lot of healthcare workers na kaibigan ko also suffered through it, no? And little by little, the call kept coming.
Mhm.
Pero I was
Mhm.
ignoring it. The call from God, from yourself, from
Mhm.
your, kept coming, but I was ignoring it until yung mga healthcare workers mismo ang tumawag sa akin and said, Minguita, why
Okay.
don't you try? Why don't you run? And
Okay.
3 times, Senator Lacson asked me 3 times to join their party. 3 times. I said no and no. I kept saying no. Sabi ko, Secretary of Health na lang ako kung manalo ka. Sabi ko, I'd rather be the executive. Ayoko tumakbo. But the
Opo.
third time, hinug na kasi tama-tama, the healthcare workers also kept telling me, no? Then I had myself vetted with somebody and I did apparently well. But there was magulo yung system, di ba? Magulo lahat. And matagal ko ng kaibigan talaga si Senator Lacson. I've known him for 17 years. And I know
Okay.
that he's really not corrupt and he's against corruption, which galit ako sa corruption kasi sa
Opo.
nakita ko. So,
Opo.
so everything fell into place. So I said, oh sige, I'll accept. And it was when I accepted it that I was at peace, Richard.
Mm.
I was at
Yes.
peace. Natahimik
Okay.
ako.
Opo.
Although mahirap talaga.
Yes.
It's a leap of faith. Tatalong ka talaga sa bangin.
Yeah.
Iiwanan mo lahat ng alam mo, iiwanan mo. Pero you know, it's something you have to do. And if you make it, even if you don't make it, at least you tried. At least you
Opo.
tried your best, di ba? For the country. So,
I agree,
ganon.
Doc.
Di ba? Di ba,
Question,
Richard?
Doc. Why is it important sa Senate? Like, pwede bang
Hmm.
anong mas maganda ba may senador din na doktor or pwede bang maging advisor na lang ang mga doktor? On your opinion po.
I have been an advisor for so many years, no?
Mhm.
And what I am doing now, ginagawa ko ngayon, parang continuation, ang ginagawa ko na for the last 27 years or 26 years, except mas may kapangyarihan ako. Mas may
Mhm.
boses ako. Mas
Mhm.
malawak ang aking pwedeng magawa. Because,
Yes.
kung advisor ka at advocate ka, you can only advise. You can only,
Yes.
but the last say is still the lawmaker, di ba? And many
Yes.
times in the past, they don't understand what we understand. Hindi nila
Mhm.
nakikita at nararamdaman natin na dun sa tinatawag na trenches, kumbaga sa gera, andun tayo sa gera, diba? Sa
Yeah.
ospital, sa
Mm.
pasyente. Hindi
Mm.
nila alam ito. Hindi nila
Yes.
alam ang nararamdaman ng pasyente at ng doktor. You see,
Mm.
I practice in both a private hospital and government hospital, PGH
Mm.
and St. Luke's. So nakikita
Mm.
ko both, no, spectrum, no? The
Mm.
spectrum of practice. And aside from that, lahat nagawa ko for the last how many years. No? So we need a doctor who can actually help legislate yung mga laws and also the implementation, who can oversee yung implementation. Kasi kung minsan, ang dami natin magagandang batas, pero hindi siya napapatupad ng tama.
Mm.
It's the
Mhm.
implementation that's always wrong. No?
Mhm.
Marami yun.
Mhm.
So, if you're in the Senate or in any legislative, like kayo, we can do oversight. Di ba?
Mm.
We can
Mhm.
make sure na yung mga batas na ipapasa ay ipapatupad ng tama. And
Mhm.
it's very
Mhm.
important that a doctor will also see that, will also know that.
Mhm.
No? So, and aside from that, Richard, I know, naintindihan ko yung PhilHealth kasi I've been there.
Yes.
Nasa loob ako, nakita ko yung mga problema na, and in order for us to have universal healthcare, yung pinaglalaban natin, no? Yung
Mm.
may equity, walang maghihirap na Pilipino dahil sa nagkasakit, may libreng
Mm.
maintenance medicine sa barangay. To have that, we have to fix PhilHealth. So, ang daming kailangan gawin. And finally, pandemic response has to be made sure that we're continuously doing well. And we have to be ready for the next pandemic. We have to be ready.
Correct.
So we do not,
Correct.
doesn't happen yung nangyari sa atin na long lockdown kasi nabulabog tayo, wala tayong infrastructure, hindi tayo handa.
Mm.
Hindi na pwede yon, no? Kasi, so
Yes.
we should learn from our lessons, di ba? From the past, lessons of the past.
Yes.
So that's why we have to have a doctor in the Senate. That's talagang
Yes,
we
Doc.
have
I
to.
totally agree. How can you Doc, how about Senator Juan Flavier?
Mm,
Do you
yeah.
think
What happened?
Juan Flavier?
Yeah. Do you think? I think you're frozen. Am I
Can
frozen?
uh
Can you see me?
yes, Doc.
Medyo
I'm okay.
nag-freeze ka. Okay.
Nag-freeze lang siguro. Okay. I'm
Okay.
okay
So you're
now.
saying about Juan Flavier, yes.
Yes,
What?
Doc. About Senator Flavier, any comments about the
Well,
late Senator Juan Flavier?
we know he was our speaker when I graduated medicine.
Wow.
Okay, and he gave me a lot of inspiration. I remember that speech of his, no,
Wow.
and like so he played a role without him realizing it. He inspired me, no, a lot. So when I graduated, and I got to know him just a little bit, no. Pero sabi ko nga, iba talaga kung may doktor sa Senado.
Yes.
He was
Mhm.
the last real practicing health advocate in the
Mhm.
Senate, no. Kasi
Yeah.
I remember si Dr. Aloy Estrada, asawa
Yeah.
ni Erap, no? She's a
Erap.
doctor, she's a psychiatrist, but she wasn't really actively practicing, no? Because she
Mm.
was the may bahay ni Presidente
I
Erap, di
agree.
ba?
Yes,
At
yes.
parang hindi siya talaga yung advocate na maingay gaya
Mm.
natin. Ako maingay akong
Mm.
advocate, I do this, I do that. Juan Clavier
Mm.
was in public health. So he was the last doctor advocate in the Senate, no?
Mhm.
So,
Mhm.
and he was an inspiration to me when I was a student,
Mhm.
no? And
Mhm.
his son, kasama nyo, di ba?
Yes po. Dr.
Sa
John D. Flavier sa Kabayan.
Kabayan. Yeah, so natutuwa ako. I didn't know eh. Hindi ko alam na kasama niya sa Kabayan. So, kaibigan ko rin si John Deep. So
Mm.
I'm, for me, I wish I could at least serve in the same way,
Mm.
no?
Mm.
As him, no? Yung Let's Do It is still very popular. Yung Let's
Yes,
Do
very
It. So,
popular.
still popular. Ako naman, noon, nung Secretary of Health si Quasi Romualdez, remember si
Mhm.
Dr.
Yes
Quasi
po.
Romualdez, I was helping them also yung mga sentrong sigla. Kami yun eh, yung mga gumawa ng
Ah,
mga ganon, sentrong sigla.
yes.
Kami yung think tank noon, no? So,
Mm.
marami
Mm.
na akong pinagdaanan dun sa DOH,
Mm.
helping and helping
Mm.
and helping. And
Wow.
then yung Universal Healthcare Act, I was the spokesperson of the
Mhm.
University of the Philippines
Mhm.
UHC study group during the latter
Mhm.
part, no?
Okay.
Yung final push,
Mhm.
Dr. Ernie Domingo, our
Mhm.
teacher, asked me if I could be their spokesperson na. Nakakatawa nga
Mhm.
siya. Sabi niya, Mingita, pwede ba ikaw na maging spokesperson ng grupo? Kasi alam mo, matanda na kami, kalbo na kami. Wala na makikinig sa amin. Yan ang kanya ano sa akin spiel. Nakaka-taste really funny. And I said, sir naman, of course, parang he was our teacher, magsaysay awardee, but that's how
Mm.
humble he is and so funny. So
Mm.
I said, of
Mm.
course, I'll be honored to be your spokesperson. That's why
Mhm.
the latter push towards 2017, 18, 19, I was part of it na yung laga nagsasalita, advocating, hanggat mapirmahan ni President
Mm.
Duterte sa
Mm.
2019, yung
Yes,
bata.
yes.
No? Na hindi
Opo.
pa napapatupad ng sapat, no? Because we had COVID
Yes.
pandemic naman.
Opo
So
nga, oo nga.
we have to really have to fix that, no? Really have to
Wow.
make people. So ang
Okay.
dami kailangan gawin, no?
Yes, Doc. At
So
actually, as I'm listening to you, Doc, talagang nakikita ko na you know all this stuff. Yeah, you're not a beginner on this. You're not just jumping from a private practice going to public. Alam na alam mo to because you're inside the government as one of the advisors and everything. So I really believe you are worthy and I hope you'll get it dyan po sa Senate. Uh,
thank you. Yeah.
ano Doc, yung sa iBank, I'm very interested with iBank. What experience you had on founding iBank that
Yeah.
somehow it could also help you on the health ano po advocacy on Senate, and also describe what's iBank din po for the benefit of everyone.
Yeah, yung mga hindi pa nakakaalam about the iBank. I founded it the foundation in 1994, and then the iBank opened in 1995, no? And parang tagal-tagal na, no? Pero hindi naman masyado, no? Time flies. No?
Mabilis lang
Actually,
ang panahon.
the, ano, no?
Mabilis lang ang panahon talaga.
Mabilis talaga. The iBank is an organism, well, it's run by a NGO that's a humanitarian nonprofit, no? An iBank, anong ginagawa? Kumukuha kayo ng eye tissue na dinodonate ng
Wow.
kamamatay lang. Okay? Yung eye
Mhm.
tissue na yon i-preserve, ilalagay sa special solution, i-store, i-evaluate namin, kukuha kayo ng mga dugo for evaluation, tapos yung tissue na yon ay gagamitin, ita-transplant sa mga taong bulag na
Wow.
nangangailangan ng transplant para makakita uli. It's not
Mhm.
easy. In
Not
fact,
easy.
when I founded it in 1994, everyone told me it's impossible
Mhm.
because there had been 5 attempts in the past since the
Mhm.
1950s. And as
Mhm.
Dr. Salvador Salceda used to say, he was my mentor, they all withered in the vine. Bangkarote. Hindi
Hirap.
nagtuloy-tuloy kasi
Mhm.
many reasons, no? And there's always a right time and a right place for something. And I feel that when I was the one who maybe God wanted it to happen also because we were
Mm.
able to do it. And until now, it's
Mm.
2021,
Yes.
what we said was impossible is still alive. No?
Yes.
And we have had many times nakakahirap kasi you have to convince people yung culture natin has had to be change, no? Yung donation culture to be
Mm.
encouraged, no?
Mm.
Nakatulong yung mga ibang mga celebrity, no? Like, I was making you kwento, no? It's sad
Mm.
because a person has to die first, di ba? Bago kayo
Mm. Mm.
makadonate. And
Yes.
yet, you can always look at it in another way. Even after death, part of you lives on. May parte
Mhm.
ng buhay mo, ng katawan mo na continuously, tuloy-tuloy, nabubuhay sa iba. No? Ang
Mhm.
isa sa pinaka-famous na donor ay si Miko Soto, yung anak ni
Yeah,
Ali.
yeah, Miko Soto, opo.
Yes, he died, di ba? He fell from a building
Yeah.
accidentally. And I remember that night very well. When his mother went to the emergency room of Makati Med, he had passed away already. Siyempre, mother, alam mo, namatay yung
Yeah.
anak mo na gano'n. Grabe ang
Wow.
grief, no? I can
Opo.
imagine how you feel, no? And yet, at a certain point, there was a moment. Kasi ganito, rewind. 1 week before that happened, guest ako sa
Mm.
radyo program nila ni Ali at ni Igan sa
Mm.
DZBB.
Mhm.
Pinag-usapan namin ng iBank a week before. And they were
Mhm.
talking about, ay, ako, supportado ako dyan. Ganyan, pinag-usapan
Mm.
lang namin about the iBank.
Wow.
No?
Mm.
Then, a week after, this happens to her
Mm.
son. No? And in her
Oh.
grief, she had a lucid moment.
Mm.
She told the people in the ER, what can I donate? Imagine that, a
Wow.
mother in her grief, she said, what can I
Wow.
donate? And then
Mm.
they said at this point, the only thing they can offer is the corneas, the eyes, the corneas. And the eye bank was still in Makati Med at the time.
Mm.
So,
Mm.
nakuha namin yung kanyang corneas ni Nico.
Mhm.
And that started a very close friendship between Ali Soto and me. This was
Mm.
2003.
Mm.
Di ko siya kilala except that radio. So what happened was that yung isang cornea ni Nico napunta sa 6-year-old girl na
Mm. Mm.
nasugatan ng mata dahil nabagsakan ng aparador. Tapos yung glass
Wow.
tumatak sa mata. Yung
Mm.
isa naman was a katulong, kasambahay, na si Jonalim. I still remember them very well,
Mm.
na
Oh.
16 years old or 17 years old na dalaga na bulag din, no? And ako yung nag-opera dun sa bata na 6 years old, si Esme.
Mm. Wow.
Recently, naging guest siya sa Itbulaga yata or sa bawal judgmental portion.
Ba
Nakita sila ni
ngayon?
Ali. Yeah,
Lately?
recently, dalaga na
Oh,
siya. Yeah, lately, I think
wow.
last year. And nakakatuwa kasi she told Ali that although her name is Esme, people call her Mika. Kasi
Mhm.
dahil sa mata. And so, they have become close rin.
Wow.
Continuous close na sila. And I remember, when inoperahan ko si Esme, 6 years old siya, dinala ko siya kay Ali para makilala shortly after the
Mhm.
surgery.
Mhm.
Tapos I can't forget, nagtitigan sila. Tapos Ali was looking into her eyes and
Wow.
it was beautiful. And sabi ko, it became, so tuloy,
Wow.
after that, Ali became an advocate na rin. The eye bank became her part of yung advocacy rin niya. And tuwing kailangan namin siya magsalita as a mother who
Wow.
donated her son's corneas, she's always very willing to speak. No? Kasi yung
Yes.
inspiring yung mga sinasabi niya. Then si AJ Perez, isa pa yun. Si AJ Perez, actor din, no? Car accident naman yun, no?
Mhm.
And his parents also gave his cornea. So my point is, although they are sad incidences, they helped the iBank also, no, with our
Yes.
advocacy. And
Wow.
so far we've helped thousands, kaya lang kulang
Wow.
pa rin. Kulang pa rin. Tens of
Yes.
thousands, kulang na kulang pa rin. Siyempre, there's always ang pangangailangan, tuloy-tuloy pa rin ang pangangailangan.
Mm.
At may waiting list pa rin. The supply is never enough. So
Yes.
we always advocate. So that was my
Wow.
baby for the longest time. Yun ang baby ko, yung iBank. So yun ang nagawa ko. I think that's one of the things I know I can say.
Wow.
If I died tomorrow, I tell people, at least I can tell the God, ginawa ko na yun, ah. God, ah.
Wow.
Ginawa ko
Thank
na
you,
yun.
Doc. Thank you for telling us that. Then, ikaw pala yun. Actually, I know those stories. Alam ko yung mga pinagme-mention mo. I never knew you were the person
I'm the one.
behind that. And it's an honor to know that na ikaw po yung kausap ko. Because na alam ko po yung story na po yon. Alam ko yung sa
Yes.
mother niya. Alam ko yung nag-meet sila. I do believe na ano yun na televised or na news.
Yes.
But I saw
Grabe
that.
yun.
And yes.
Yeah. And then
Uh,
they even did like alaala mo kaya or something. Both
yeah.
stations.
Yeah,
Dalawa yun
opo,
eh.
opo.
Then they had stories about the two different recipients and
Yeah,
that was a major boost also to the iBank, no?
wow,
Because of that. So that's me. That is my, I would consider one of my greatest contributions, I think, to ophthalmology in the
wow,
country. No, is that no. So as I said, alam mo, Richard, those who know me, yung mga nakakilala sa akin, yung mga, especially mga estudyante ko, ma'am, sigurado ba kayo? Gagawin niyo to? Kasi, parang, kailangan, kasi alam niyo, sabi ko sa mga estudyante ko, gagawin ko kasi hindi ko na kailangan ito, pero kailangan, gusto kong gawin. Kasi
Mm,
whatever,
mm.
whatever time I have left, whatever I
Wow.
have left, no, I will give it my all. Whatever ginawa ko as a doctor, as an advocate, lahat
Mm,
ng
mm,
energy, dedication,
mm,
passion that I
mm,
gave to the eye bank, even to just put
mm.
that passion, ibibigay ko dito kung pagpalain ako, no?
Wow.
And I get a seat, I will give
Mm,
the same passion and dedication, no?
mm,
And integrity. Yun ang sinasabi ko. Because, in whatever time I have left in this earth, you don't know, di ba? How much
mm,
time we have,
mhm,
no? I
mhm.
just want to do this and try,
Opo.
no? Kasi for the future, for the
Mm,
children, for the
mm,
grandchildren, di ba? Para sa hinaharap na, para sa darating henerasyon, no?
mm.
We have to do this. No?
Yes, I
Uh,
agree. So
yeah.
Doc, you are running under ano Doc, no? Under Lacson and Soto,
Soto, yeah, Partido Reforma. Reforma.
Partido Reforma. Doc,
Um,
can you let's go politics po, Doc. Of course, many
okay,
people are still thinking on their president and presidentiable.
yeah.
Why Lacson? Why Soto po?
Okay, one is, aside from the fact that I know, the one I know who's my friend for a long time is Lacson. Okay?
Mhm. Mhm.
And he doesn't mind my saying he's also my patient. Pasyente ko rin siya. Ako nag-check up
Okay.
ng buto niya, pati staff niya, all that stuff. No? So, but I saw firsthand also, whenever we had mga advocacies or may mga issues on corruption, siya talaga ang nag-take up ng cudgels. Okay?
Mhm. Mhm.
And can you hear me? Kasi
Yes,
you're
yes.
frozen. Okay.
Yeah.
And I believe that corruption is one of the major problems of our country. That's
I
why
agree.
we need to address it. And I think a lot of people, alam rin nila corruption, malaking problema yon. At kailangan natin ng presidente na talagang kayang humarap sa korupsyon at may solusyon at nagawa na ng all these years. No? Not
Mhm.
getting a 200 million pork barrel every year is not easy.
Wow.
Okay?
Mhm.
Di ba? For the last 18 years, never.
Yeah.
No?
Mhm.
Only once in the beginning that he realized there's so much potential for corruption, wala na after that. That's very
Mhm.
difficult to do. The late Senator Boots Aquino used to tell me that, alam mo, Minguita, ang hirap ng ginagawa ni Tim. Ang hirap niyan. No? Anyway, then aside from that, the advocacy of the party. Kasi
Mhm.
Partido Reforma, inaral ko rin yan. I'm trying to also um, uh, parang create more mature party systems. Ano yung party system natin is not mature, di ba? Kahit
Mhm.
matalog-talog ng mga tao, walang advocacy yung party.
Yes.
Anong ibig sabihin ng
Yes.
partido mo?
Opo.
So, ang Partido Reforma kasi, aside from being God-centered, it's reform, kaya reforma, reform-minded, and it believes in strengthening yung LGUs, mga local
Mhm.
government units. Kasi kailangan natin palakasin so that ang ating response sa kanila, ang nangyayari kasi ngayon, nagdi-dictate yung Manila, yung central, that's why they call it Imperial Manila, magdi-dictate, tas, ito yung pera ninyo, ito. Cannot be like that. It has to start from below. Sila
Mhm.
magsasabi sa atin anong
Mhm.
kailangan nila. Hindi
Mhm.
sila magbebeg, hindi sila malilimos sa central. Kailangan they're part of the planning. And that's
Mhm.
what we want to see, no? And we
Mhm.
want to increase their funding, okay,
Mhm.
to the local governments. Um, Problema kasi we have a local government code, but there's no full devolution. In other words, they devolved health, they devolved uh, agriculture and other aspects, pero walang pondo.
Mhm.
So ngayon, nagkaroon na ng mandanas ruling ang Supreme Court, no? So that means the money na bababa dyan will be increased by about 30%,
Mhm.
27.6 and up, no? So that money, kailangan tama ang paggamit.
Correct.
Health is one of the major, and agriculture,
Yes.
and then infrastructure, those three. So, kailangan tutukan yan. So, I feel, yung implementation, yung paggamit ng pondo, di ba, si Lacson is always the one guarding the budget. Every year yan, kinikilatis ang
Mhm.
budget. Kasi
Mhm.
nga, ang daming naaksaya, ang daming napupunta sa bulsa ng kung sino man. No? And that has to stop. And because I feel very strongly about this, I felt that magkatugma yung aming
Mhm.
advocacy
Mhm.
against corruption. So it's very strong in me. You know, my father was a Supreme Court Justice. And
Mhm.
also my father, napakalakas ng anti-corruption zeal ng father ko.
Mhm.
No? In fact, when he retired from the Supreme Court, nag-valedictory siya, it was about corruption in the judiciary. And he
Wow.
was lamenting and lamenting it. And nagalit sa kanya maraming ang mga kasama, no? Kasi sinabi niya ang totoo. And there is, no? And I
Wow.
remember Ted Filon interviewed my father after he retired
Mm.
and
Mm.
asked him, Justice Padilla, sa tingin ninyo, anong porsyento ng corruption sa judiciary? Ang sagot niya, 80%. Ano sabi ni Ted
Wow.
Filon? Sabi niya, ganun ang kanyang assessment. And my
Mm.
mother was so scandalized by what my father said. No? He's, ano ka ba naman? Bakit mo sinabi yan? And my father said, alam mo, you know, one day he told me, one day you will be glad I said this. Kasi
Wow.
I cannot, ano eh, sabi niya. So he really felt so strongly about corruption. And for me, it's what's keeping our country and our people from really, rising and developing and
Yes,
flying,
I agree.
the culture of corruption. So we need to address it, no? And sometimes nakakatakot, sometimes magagalit sa yung
Yes.
tao, no?
Yes.
But kailangan. So that's the main reason, no?
Thank you,
Okay,
Doc. Doc, may questions tayo. Ilalabas ko din. We'll try to
sure,
answer it. This is
sure.
from Julius Patrick Apod. Doctora Padilla, any ideas on free market options for affordable health
Health
insurance
insurance.
for
Okay,
taxpayers?
okay. Okay, we have the National Health Insurance, which is PhilHealth. It's a
Yes.
socialized health insurance. Okay, now there was supposed to be a PhilHealth Plus because what's happening now is that we are being told we have to pay. Diba? Those of us who are working, those of us who are employed or self-employed, the law says we need to give contributions. If we do not give contributions, we can still avail of health insurance because it's socialized. It's in the law. No Filipino should be deprived of health insurance, even if you do not pay. If you cannot pay or do not pay, you if you cannot afford to pay, you're going to be what's called an indirect contributor. Wala kang bayad. It's only the sin taxes that pay for you, di ba? The government, what do you call this? The coffers. No, everyone who's paying pays for the non-contributing. So that's affordable kasi wala kang bayad, no? Now, if you're talking about private health insurance, ang dami dyan. No? My beef lang with, can you hear me, Richard? You're
Yes,
okay?
yes
Yeah.
po. Yes.
My beef lang with the current Universal Healthcare Act is that it has a clause that every year the PhilHealth contributions will go up by 0.5% starting
Mm-hmm.
2019. And
Mm-hmm.
I'm not in favor of that. And I
Mm-hmm.
will try, I want to have a moratorium. I think there's one already now, but maybe a TRO or something because, or oversight and stop it first or amend it right away. You know why?
Mm-hmm.
We taxpayers who are contributing to PhilHealth with our premiums should not be made to uh, pay more because of the inability of PhilHealth to collect properly. May problema yung collection efficiency sa loob. So bakit tayo pataas ng premiums so hindi pa inaayos yung collection sa loob? And I want that fixed. I don't want that one to go up yet, no? So, kawawa tayo eh. It's not fair, no? So for affordable health insurance, we have it in PhilHealth. Okay, it is a health
Mm-hmm.
insurance, no? There was supposed to be a PhilHealth Plus. PhilHealth Plus is for those who want more. You pay a little bit more, you get more benefits.
Mm-hmm.
Okay, and then there's of course the HMOs. But you
Mm-hmm.
know, PhilHealth is health insurance. It's affordable. It's universal. We just have to fix it to make it work.
Okay.
Okay.
Thank you. Thank you, Doc. Good point. Ito po comment ni Richelle. Richelle, still finding who to vote for senator. Might consider this so they can create bills that help Filipinos in health areas. Health
Correct.
is wealth. A healthy Filipino is a wealthy Filipino. Any comment for Richelle, Doc?
Absolutely true. Because remember, health is really wealth. You know, the COVID pandemic showed that to us. A small virus that's invisible to the eye, to the naked eye, caused havoc in the world.
I
Health
agree.
was affected, economies stopped, economies collapsed. You see what health or the lack of it can do. So health
Yes.
is wealth. And it
Yes.
showed us that, we always knew that our health system was weak. It's weak.
Yes.
But we
Oh,
never knew how weak until we got the pandemic. Okay?
yes.
And one of the reasons we had to have these lockdowns, okay, tagal-tagal, is because hindi kaya ng ating health infrastructure na hindi mag-lockdown. Because we didn't have
Mm,
enough hospitals, we didn't have enough medicines, we didn't have
mm,
enough, what you call this, equipment, we didn't have enough
mm,
manpower to manage the people getting sick. So what do?
mm,
You lock down. Okay? But the prolonged
mm,
lockdown naman caused our economy to collapse so much that NEDA itself, with Dr. Carl Chua, estimated that because of the lockdowns, the prolonged lockdowns, and the economic downturn, it may take us 10 years to recover. Wag naman
mm,
sana. Let's try to
mhm.
recover faster. And
Good point.
right now, the vaccination drive of the government, the very aggressive drive, is correct. We
Mm,
have to vaccinate as many as possible, as fast as possible. Okay? Because, again, a person who is not vaccinated, especially if you have immunocompromised state, meaning mahina ang immune system mo, para kang petri dish ng virus. A
wow.
petri dish is yun ba yung alam natin yung kunyari may sakit ka, no? Tapos may ubo ka or something, infection, kukuha ng sample,
Mm,
kunyari sa lalamunan
mm.
mo,
Good.
patutubuin dun sa petri dish, tapos ipapatubo
Yes.
sa laboratorio para malaman ano bang mikrobyo ito. Yung
Mm,
tao na walang bakuna, na
wow.
mahina ang immune system, ay parang
Mm.
petri dish para sa virus. Pag nilagay mo sa loob niyan, dadami at dadami at
Dadami.
dadami. Hindi lang yon, mag-mutate at magkakaroon ng variant.
Yes.
That's how you get the
Yes.
variants. Kaya ngayon, naghahabol yung gobyerno, naghahabol tayo, mabakunahan as many as possible, as fast as possible to avoid these kinds of things from happening. So we are in a good place now, Richard. Right now, we're in a
Yes.
good place, no, and that's why we're seeing herd immunity happening. We just have to
Yes.
keep doing this and keep
Keep
doing
doing.
this. Yeah. So health is really wealth, and
I
that's
agree.
kaya ang aming mantra, kailangan ng doktora sa Senado
I
kasi
agree.
sa policies natin, no,
Opo.
nakakaintindi. Oo.
Ito po, Doc, from Princess Adora. Thank you for the info, Doktora Padilla.
You're welcome.
Ito ay sabi pa rin ni Rachel, I believe na we need a health worker to represent us in Senate. I totally agree.
You know, Richard and
Yes po.
Richelle, no. There was this group called Nurses United, headed by Maristela, no? Um, and si Mendoza, no? Si Robert Mendoza. Hindi sila na-approve ng COMELEC. Their party list group was not given accreditation. Iyak sila ng iyak, no? So I
Mm,
said, don't worry. Kami na lang, hopefully you pray na lang and you help us para yung mga doktor makapasok, we can represent you. And to
mm,
tell you frankly, Richelle and Richard and all those listening, it was these groups, the nurses, the doctors, yung medyo maiingay din ng mga doktor at nurse. No? Sila
mm,
talagang tumutulak sa akin, tawag na tawag
mm,
sa akin,
mm,
tumakbo na kayo. So I told them, hayaan mo, never mind. No? Hopefully, we were hoping that they would be accredited. But even if they're not, sabi ko, hopefully, God willing, you'll still be represented in the Senate. No? Para, and of course, kayo sa House. No? Meron din silang
yes po.
representation. No?
That's our
So, yes,
prayer.
I agree. We need to be represented. Health workers to be represented in legislation. No?
Thank you
Not
po,
just
Doc.
in the party list, but in the Senate as well. No?
I
Para sa
agree,
organ.
Doc.
Yes. Yes.
Reynaldo Segara Abacan Jr. Doktora, may plano po ba kayo para sa organ donation advocacy sa ating bansa?
Definitely, definitely.
Yes.
Isa 'yun sa ating mga plataporma. As you know, the iBank it's an organ and tissue donation. And isa sa mga position ko, I'm an advisor for the um ano for the program of the DOH and organ donation, no? I was been an advisor for some time. And ang problema kasi natin, kulang ng advocacy, kulang ng implementation ng Organ Donation Act. For example, Francis Sarmiento used to be the head of the PhilNos, okay? He became my close friend. We were trying to push to amend the law, okay? And maybe the IRR strengthen it so that meron tayong what we call required request, no? You must request. Problema kasi, Richard, marami na sa atin, we are card-carrying donors, yung driver's license. Marami na sa atin, especially the younger ones, are all in favor of organ donation. Pero wala namang nagtatanong sa ospital. Nobody asks. If nobody asks, how can you get? No? So there should be
Correct.
required requests. No? And then second is we have to now get the LTO more involved kasi yung driver's license, ano lang siya eh, parang ano lang, parang it's how do you call this, token support lang ginagawa nila. Before the pandemic started, nag-meeting na ako kasama ng LTO. Okay? Who's the head of the LTO? Si General, gosh, I forget. It's sorry. We had a meeting. Calvante, General Calvante. Nag-meeting kami in order to strengthen itong Organ Donation Act through the driver's license, no? With the police, kung may aksidente, titingnan nyo yung driver's license, tingnan nyo yung likod. Kasi ang ilan dyan, nakalagay, yes, I want to
Mhm.
donate. And once you
Mhm.
see that, you call right away the hospital. There has to be
Okay.
a system. We must institutionalize this. We must make it a law.
Wow.
Hindi lang ano. Second, another one, ilagay natin sa mga sa mga funeral plans. Di ba yung mga plans,
Mhm.
memorial plans natin? Kunyari, you have a St. Peter's Memorial Plan, di ba? Nakalagay doon anong klaseng ataul, anong klaseng service, di ba? Tapos meron ka pang bilin sa anak mo, o ito yung gusto kong damit, di ba? I mean, we all have these plans. We should also include organ donation in the memorial plan para alam rin nila. So parang exit plans. I want it has to be already part of part of our life na we think about it. When I leave this earth, pag umalis na ako dito sa lupa na ito, pupunta na ako sa langit, anong gusto kong iwan? Gusto kong iwan itong aking alahas dito sa paborito kong anak, for example. Gusto kong iwan di ba? Ganon gusto
Wow.
kong, ano pang pwede mong iwan? Gusto kong iwan ang aking mga mata, mga cornea, ang aking kidney, para merong isang tao, mapahaba ang buhay, may maraming tao, 2, 3 tao, or 4 na tao na makakita uli. Di ba?
Wow.
So, we have to make organ donation such that becomes part of our life, no? Part of our exit plan. Parang ganun ang gusto kong mangyari, no?
Thank you,
So
Doc.
pwedeng gawin
Talagang
'yon, i-legislate 'yon, no?
wow. I think only a doctor in the Senate can do that, Doc. Kasi
And a
there should be
doctor,
passion eh. There
yeah,
should be a
yes,
passion.
there's passion. And a doctor who's been involved in organ donation, who's been frustrated.
I
The
totally agree.
frustration, di ba? May hugot. In others, may hugot.
Yes.
May hugot ako kasi
Somehow alam mo
kailangan,
na yung ano, Doc. Alam mo na yung pasikot-sikot dyan sa issue. I know
alam
merong
ko,
mga hindrance, but somehow you know how to go through
we
it.
have to overcome it. And Richard, what we've noticed also, the younger generation is more open to it, no? Kaysa yung
Wow.
older generation, no?
I do agree.
So, di ba, mas madali silang, it's easier for them to consider it and as part of life, di ba? They want to live on to others. So, we have to take advantage of that, no? Let's
Yes,
fix our
thank you.
laws.
Thank you, Doc. Doc, may supporter tayo. Dennis Garzon. Sabi
Oh,
niya,
yay!
first senator.
Yay!
Thank
Salamat!
you, Dennis. From
Salamat! Go,
Kring
go, go
Kring.
naman!
Go,
Kring,
go,
kring.
go. Opo.
So,
Ito, Doc. Yes, Doc.
how
May
can those who drop the ball
drop the ball on the
okay.
pandemic response may be
Yes.
accountable.
Actually, they should be held accountable. I am not at liberty to reveal everything I
Okay.
know, pero alam ko rin na may mga grupo na may mga kakasuhan, no?
Mhm, mhm,
From private individuals are planning
mhm.
to file charges against them. Okay?
Okay.
Uh, Based on evidence gathered in the
Mhm,
Senate, no? In
mhm.
the House, whatever, basta based on evidence. It has to be based on evidence,
Opo,
no?
opo.
Na to build a case or cases against certain people. So I agree that they must be held accountable because unless people are held accountable, people in government, then you will
Mhm.
never end corruption, di ba? Kasi kung hindi sila takot walang nananagot, kailangan may managot eh. Parang sa Singapore, may nananagot, no?
Mhm.
And then the justice should be patas, no?
Yes.
Patas yung hustisya, no? And then I keep hearing a lot of senatoriables who are lawyers also saying, what matters is the certainty of punishment. Yung talagang alam mo So kung
Na
may
may
ginawa
punishment.
kang masama, talagang mapaparusahan at held accountable.
Good
Pero kung,
point.
di ba, the certainty of punishment is what's important. We have to push for that also. No?
Okay. Doc, may magigreet. Ito po si Bishop Paul Hernandez. Siya pong ating number 3 nominee ng ating Kabayan Party
Bishop,
List.
Bishop.
Pastor po ng
Ah,
Kabayan Party List. Siya po yung nominee number 3. I think siya po yung nag-pray during you were the one na nag-opening remarks.
opening remarks, yes.
Opo, nung
Pero recorded
Friday.
yung,
Opo,
hello,
sige.
hello, Bishop. Hello, Bishop Paul. Good evening.
Hello, Bishop Paul. Okay, Doc. I'm gonna give you a few minutes. Gonna make the screen wider to focus on you, just for you to talk to the people w- um, and invite them on the thought that a doctor should be a senator.
Can I speak?
Uh,
You want me to speak in English or Filipino?
Filipino is much better po.
Better. Sige ho.
Opo.
Oo. So, salamat Richard, no, Dr. Mata at sa Kabayan Party List na binigyan niyo ako ng pagkakataon na maging guest dito sa magandang programa ninyo, no? At ni Richard Mata. Okay, ako po si Dr. Minguita Padilla. Ako ay isang doktor, ilang dekada na, 3 dekada na, no? At ako'y tatakbo para sa Senado. Kailangan na kailangan ho natin ng isang doktor sa Senado na doktor na hindi lang basta doktor, doktor na nakakaintindi ng mga problema ng bayan, hindi lang mga pasyente sa klinik, no? Doktor na tumulong na rin sa gobyerno at nakita yung mga pagkukulang. At doktor na may tinatawag na passion at hindi siya takot na magsalita at dumaban para sa taong bayan. No? Um, at sinasabi ko sa inyo, at this point in my life, sa puntong ito sa buhay ko, pwede na ako magpahinga kung sa tutuusin lang, pero hindi eh. Meron pang kailangan gawin kung bibigyan ako ng pagkakataon. No? At kung pagpapalain ko ng Diyos na maupo bilang senador ninyo, ay asahan ho ninyo na ang pagsilbi ko sa aking mga pasyente, pagsilbi ko sa aking profesyon, yung integridad, yung katapatan, yung kasipagan, no? Na binigay ko as a doctor, ibibigay ko ho ng buong puso bilang senador. So, yun lang ho, kailangan ho natin ng doktor sa Senado, marami pang gagawin para makamit natin yung sistema ng pangkalusugan na talagang gusto natin, no? Na walang Pilipino ang maghihirap o maghihirap dahil lang siya ay nagkasakit, ay panatag ang loob natin na aalagaan ang ating kalusugan mula sa sinapupunan hanggang sa libingan. Okay? So, pagdating ho ng Mayo next year, alalahanin nyo, sana maalala ninyo na may isang doktora na tumatakbo para sa Senado. Magandang gabi po at maraming salamat.
Salamat po, Doktora. No, sana hindi natin makalimutan may doktorang tumatakbo. Kasi
So,
akala nila wala nang doktor na tumatakbo, meron pong doktora, maganda pa. So,
masipag.
yan po ang ating yan po of course I will remind the followers as well
And
na isang
yeah,
doktor,
and Richard,
isang doktor po.
napakalaking bagay sa akin ang suporta ng Kabayan Party List. No? I really appreciate it very much. No? And I hope we can work together in the
Yeah, and that's
future.
my prayer, no, Doc, na
Yeah.
God
Yeah.
willing kung kami ay sa kabayan ay makapasok rin, we hope that you will be there as well sa
Yeah, I
Senate
hope
para
so too.
mas
I hope
maganda
so
po
too.
yung teamwork natin.
I pray for that.
Opo, meron lang isang comment pa dito gusto ko lang mabasa din po for you, Doc. Before we end,
Hope to
no?
meet you soon,
Hope
sir.
to meet you soon, Doktora. Mukhang ikaw po ang hanap ng
Oh,
namin na senadora sa Dialysis PH Support Group Incorporated. Tama po. Siya
salamat
po
ho.
yung
Ah,
opo.
may trivia ho ako. May trivia ho ako sa dialysis.
Sige po,
PhilHealth
Doktora.
ho ako, nung nasa PhilHealth po kami ang nag-increase ng coverage ng dialysis from
Wow.
45 to 90. I know it should be a little longer. But you know, the dialysis, very few countries in the world include dialysis sa health insurance. Kaya gusto ko ho, sa universal healthcare, mababawasan ang need for dialysis. At kung ma-improve natin ang Organ Donation Act also, di ba? Kasi dialysis, you need a kidney transplant, di ba? At yung kidney transplant ang mas definitive na reply, no, na answer, na tugon dito sa kidney failure. Kaya lang, kulang ho ang mga kidney donors natin. So we have to
Wow.
fix that also. No?
Oh, yan
So thank
na,
you very
sir.
much,
Oo.
Reynaldo Abacan Jr. No?
Rinaldo, ayan na malinaw
Salamat.
na. Alam na alam ni doktora yung
Alam ko
ano mo,
yan.
yung
Oo.
issue natin. Alam na alam niya yan. Hindi na kailangan i-explain kay doktora anong
Oo.
dialysis dahil alam na alam ni doktora ano na yan.
Alam ko yan.
Opo. Also, Doc, from Sabirin Quinjio, SK Federation
Santa
Official
Cruz.
of
Oh,
General Santos City, Doc, Senator, we will support you, Senator. No?
thank you.
And
Nakakaiyak naman,
also,
oh.
of course,
Salamat
and
ho.
also
Go
Elizabeth
po.
Dunca Flores. Go, go, Doktora Padilla. God bless you po.
Thank you so much, Elizabeth. Nakakataba ng puso itong mga comment ng mga guests mo,
Opo, Doc,
Richard.
kasi talagang ito pong nagfa-follow sa atin po. Health lovers talaga ito sila, Doc. So I know they will love that idea na merong doktor sa loob ng Senate. So I do believe
I
as
hope,
we as the months go on, Doc, malalaman natin may doktor pa lang tumatakbo kasi maraming hindi po alam.
yeah, we
So,
will, yeah.
yeah,
Anyway, wala pa akong TV advertisement, so I said kailangan
okay.
na, maybe, pag dumating na malapit na yung maybe January, meron akong balita,
Opo.
may ginawa kaming sine tungkol sa buhay ko, yung
Oh,
aking legacy nito. So hopefully,
yeah.
mapapalabas ito. Pag napalabas ito,
I'll share it. Opo.
yes, I will let you know because it's going to be free naman YouTube and Facebook eh. So, hindi ko pa sasabihin kung sinong gaganap,
Okay.
surprise, no? Pero
Sige po,
isang
Doc.
isang isang
Allow
popular
us
na
to,
actress, isang
yes.
popular actress. So I
Excited
will
kami
share
dyan.
it with you. Para
Excited
malaman
kami.
nila ano bang buhay nitong anong kwento
Yes,
ng
of
buhay nitong
course.
Oo. So I'll have it sana by January para at least it's entertaining para siyang may comedy, may drama, may romance, no? May
Pero dapat
gano'n.
maganda yung ano, Doc, ha, yung artista, ha.
The
Baka
actress.
kasi matatalbugan
Oo.
mo eh. Kailangan talagang level-level.
Na maganda siya kung pumili eh. Tapos
Okay.
tapos tatlo silang
Okay.
pinagpilian namin. Tapos I
Oo.
was down to two. So kinausap ko yung aming kasambahay sa bahay kasi hindi na ako in touch sa mga artista eh, no? Hindi ko alam
Mm.
kung sino ang popular. Sinabi ko, sino ang papanoorin niyo sa dalawa? Ito talaga. Lahat sila. Pareho ang pinili.
Sige,
Sige, ito magiging ito
antayin na lang
gaganap.
natin.
Hintayin
Excited
na lang
kami
ninyo.
diyan. So
Maganda siya,
estimate, Doc.
mabait.
Estimate, Doc,
Beg your
kailan
pardon.
po? Kailan po 'yan? Estimate.
January.
Okay.
January ang palabas. Next month. Yung kasi kailangan mga January kasi hopefully to be finished, no. So little by I will get in touch with you kung may mga pakita na
Yes,
yung mga
please. Yes, please.
teasers, no. Uh,
Opo.
Tulungan niyo ako para diyan para
Please po.
ma-entertain naman rin kayo.
Sige po, Doc.
Entertaining.
Ano na yan, excited kami diyan. Excited kami. And we wish
Sige.
you well, Doc. And thank you so much for this evening. Thank you
Thank you.
na kayo po'y you're very ano po no, yeah, very open for all of us and we thank you for that.
Thank you. Thank you very much for this opportunity. I really appreciate it, Richard. Good night. Yeah.
Okay po. Thank you po, Doktora. God bless po. Okay, salamat po. Thank you so much sa lahat ng nakinig, nanood, sa mga nagtanong, thank you so much. May point talaga si Doktora eh. Alam ko naman ang nasa isip lang natin, hindi pa sikat yan eh. Alam na natin 'yon. Kung sa pasikatan naman, marami naman talagang mga sikat pero ang daming sikat na hindi na dapat nandiyan eh. Kailangan na natin ng mga bago. Ngayon kailangan natin ng doktor. Sana makumbinsi ko kayo sa 12 na pipiliin niyo may isang doktor, no? At least ito may doktor na. Kayo na bahala po, no? Basta may suggestion sa 12 na pipiliin niyo. Bahala na hindi doktor yung 11, at least may isang doktor. So I think Dr. Minguita Padilla is really worth it dahil alam na alam naman niya yung mga pasikot-sikot dito dahil hindi naman siya beginner on this thing. So with that po, magandang gabi sa lahat at pahinga na muna tayo and again, see you again tomorrow. And again, coming po from the Kabayan party list, may you have a good night rest. Thank you po and God bless.